Nursing and provide some answers to any questions you may have. I'd like to begin by introducing myself. My name is Grace Gerass. I'm the new Assistant Director of Communications and Alumni Engagement here at the School of Nursing. I started back in January, so I have not had the opportunity to meet all of you just yet, but I'm definitely looking forward to doing that virtually today. So before we jump into today's discussion, I would like to cover just a few housekeeping items. Please take this opportunity to mute yourself if you haven't already. We're asking everyone to please stay muted until it's your time to speak so that we don't run into any audio issues. We'd also like you to please enter your name, graduation year, or affiliation and your email in the chat function, which you can find at the bottom of the screen. This will allow us to keep track of who's here and then provide any relevant information after the fact. And we know that a lot of people wanted to receive these updates but weren't able to attend, so please note that we are recording this. And we will be sharing it with you probably later today. That's the goal. So in terms of the agenda, we will begin today by allowing each of our panelists to provide their updates. So if you have any questions throughout the discussion, please post them directly in the chat box. In order to avoid talking over one another, I'll call on each participant one at a time so that you can ask your questions. And then if we don't have enough time to get to your question, we will follow up with you through email. That's another reason why it's really important to please include your name and email in the chat function if you haven't already. So now I'd like to begin by just briefly introducing each of our School of Nursing panelists. We're happy to be joined today by Marsha Lewis, Dean and Professor of the School of Nursing, Pamela Paplham, Assistant Dean of MS and DNP Programs and Clinical Professor, Catherine Mann, Assistant Dean for Undergraduate Studies and Clinical Associate Professor, Rebecca Lorenz, Assistant Dean for PhD Program and Associate Professor, and Yuping Chang, Associate Dean for Research and Scholarship and Associate Professor. So let's begin by please hearing from Dean Marsha Lewis.
It looks like there are more of us than our alums, but many of the people who are here, who are faculty, are also alums. So I guess we do have a good number of alums on the call as it is. I just wanted to welcome you all to our first ever Zoom chat and to say Happy Nurses Week and Happy Nurses Month to everyone. What a time this has been. I am so thankful and respect all of you so much for what you do. I know, and thanks to Grace for really spearheading this event, and hopefully it will be the first of many where we can get together and talk. Grace mentioned that we will answer your questions, and I would have to put a caveat in there. We will answer your questions if we have answers. We may have to go find them because, as I said, this is a moving target. Everything changes in such a short time. We may not always know the answers. As you know, this has been an unprecedented spring for everybody, but certainly for the School of Nursing. Within a week, we needed to get all of our coursework up on a distance format. We were very fortunate, first of all, to have incredible faculty who are very agile and willing to take a look at how they can do things differently. Because of course they're nurses, and that's what nurses do. We have great educational technology and IT staff who have been just tremendous in making things run and keep running. So Tim Nab is on the line with us today just for that purpose. He's our director of IT, and it's been great to be very comforted that the system works. We've had certainly a lot of challenges this spring, but I want to say that I think we've had more successes than anything, and that's been because of everybody who's worked so hard. And I think that's important. Our first goal this spring was safety for the faculty, staff, and students, which is why we went online. Now, we were lucky because the School of Nursing has a number of online programs, and pretty much all of our courses have an online component. So students were used to it, faculty were used to it, but obviously it's a big change when your whole program needs to be online. The other thing that was really our second very major goal was to keep our education as robust as possible, and certainly to do what we needed to educate our students and get those seniors and last year graduate students graduated. And with great pleasure, I can say that next Friday at 9 a.m. will be our online graduation commencement ceremony, and everything looks like it's up and running and ready to go. I want to tell you just a little bit about that commencement ceremony, but I just want to backtrack. One of the things that has been the hardest, I think, this spring is that not only are students trying to get through their coursework, feeling anxious about what's happening, but also many of them, particularly our undergraduate students, may very well have lost their part-time jobs. So we have noticed certainly an uptick in both anxiety as well as in need. We have a Julia Biscaglia emergency fund for students. We've had it for a number of years. This year, we're asking very much for anybody who can donate to that fund to do that, because students are sending us heart-wrenching requests because of losing jobs, trying to stay in school, wanting to get their degrees to be able to either be a nurse or to move on to advanced practice. So if any of you are looking for ways to help our students, that fund is an incredibly wonderful opportunity. I know that Grace was going to put a URL online somewhere so that everybody could see that, but normally I don't ask for money from people, but this time it is vital. Our students desperately need it, and we want to do everything we can to help them to be able to continue doing what they do best. And we are so proud of what they are doing. Just a couple of things I want to tell you, if I could read with the darkness here, about our ceremony this year. As you can imagine, it's going to be online. In fact, the first commencement ceremony was last Friday. It was the School of Medicine, and I heard that it was a success, in spite of the fact that I've said to so many of my students, I wish I could shake your hand as you cross the stage. And so I will be doing that virtually in some ways. But we will have a link, and that will be up to, there's a link that's going out. The first time that link will be shown is at 9 a.m. next Friday, May 15th, which is our graduation time. It's also, because it was pre-recorded, people can watch it at any time they wish. But there's also going to be a social media part of that, so people can send in comments and congratulations, just as we were hearing. It's, as we've talked about, it's virtual. We'll have everything you would expect. I've got a number of us did pre-recorded presentations. So the dean, the provost, the president. We have two students from Sigma Theta Tau, and we have our guest speaker, who is Corey Smith. She's a doctor of nursing practice from 2013, and she was our first family nurse practitioner DNP graduate. So and she's working at Roswell right now. We're very proud of her, and we're very happy that she was able to also share with us. And I think anything else you might need to know will be online. So I know I only had 5 minutes, so I'm sure I ran over, but I just want to tell you how pleased I am to see you, and hope that this can be the start of a number of opportunities we can do together. Grace, you're muted. Someone said to me, I don't want to ever have to say again, you're muted, but right now.
Well, perfect. Well, thank you, Marsha. Pam, if you would like to please provide your update now.
Sure. Nice to see everyone. Hopefully someday I'll get to meet you in person. I just wanted to let you know we have 5 graduate nursing programs, Masters in Leadership, and then we have 4 advanced practice nursing programs that are DNP now. They are adult gerontology, primary care, family, psych mental health, and CRNA. And so, as you can imagine, when COVID hit, it was very concerning, and our safety for our students was the top priority, especially with the PPE shortage. We did pull students out of clinical. Thankfully, most of our seniors that were graduating had completed their hours. There was a small handful, and we were able to, once things settled down, get them back into the sites to finish. So we have all of our students that are graduating next week were able to complete their hours. We do have some students that are a year away from graduation that will need to make up some time, but again, our priority was the safety of the students, and we'll figure out how to do that. We've been very fortunate in terms of doing summer placements. Some of the sites have not opened back up yet, but we're trying to onboard, and so we're ready to go if they do accept our students. And we've been able to order some backup PPE in case the sites don't have it, that students can bring their own. That's a work in progress right now. So the university and Dean Lewis have been great about working with us to make sure our students have what they need to get their clinical time, but again, to be safe where they are. The fall does remain to be a question in terms of whether that will continue to be online and what that looks like, especially if we get a second wave. So all I can say right now is we're just taking it one day to 1 week at a time and doing the best we can to get students in clinical, and keeping our fingers crossed that, you know, everything will continue to settle down. Most of our students that are in the graduate programs are on the front lines, and they're continuing to practice as RNs as they move through the program. So we're all very proud of them because they've really demonstrated the work of a hero. So that's about all I have to say before I cry, just because I'm so proud of all of them.
That was wonderful. Thank you so much, Pam. Now, Kathy, if you would like to please provide your update.
I'm sorry, took a minute there. Good afternoon, everyone. Great to see some faces that I know I haven't seen in a long time, and people that I don't know. To give a little update on our undergraduate program, obviously COVID-19 has impacted all of the programs at the university. We have some really wonderful undergraduate students who, when given an option to do virtual simulation for their senior immersion experience or go back into clinical, about 40%, a little over 40% chose to go back to clinical and have been caring for patients, getting ready to transition into practices in their first role as registered nurses. It was a really interesting semester as we took our students and did some virtual simulation with them as a learning tool, which is, as you can imagine, a little bit different than being live in clinical. However, students have participated and done in one class up to 108 hours of clinical using virtual simulation. We got through about half the senior semester, and same for our juniors with live clinicals, so at least they had about 50% of that in clinical practice. So as you can imagine, it's just a changing face of practice and how we educate our students. In addition to the COVID, because COVID is such a big piece of everything, I want to mention that our ABS students are coming in this summer. We've arranged a program of study for them to be partially online and some coming to campus and then being in clinical. We've been very fortunate that we're back in clinical practice with two of our practice partners, Kaleida Health and Catholic Health System. So we're very happy to have these strong partnerships and are hopeful that we'll be back in the VA. I talked to the VA yesterday. We're hoping to be back at the VA for the end of summer also. So these are just great things to see our students learning in such a turbulent time in clinical practice. I also just wanted to highlight a couple of other things. Our great boards pass rates that we continue to have. Our NCLEX pass rates the past 2 years have been 100% for our accelerated bachelor's program. And then it was 95 and like 96.5, something like that the past 2 years for our traditional program. So the past year average was about a 98.5, I believe it was. So we're doing really well in terms of preparing our students to be out there in practice and get great feedback from our practice partners at how well our students transition to practice, how happy they are to hire our students. So that's just an attestation to everything that the School of Nursing does to educate our young men and women to go out there and practice and be true leaders. They also like to keep in contact with us and share their stories and come back afterwards, and specifically with Donna Fabry, who's our pre-licensure program coordinator. Keeps in great contact with students, and I know Linda Steeg's on here and she does also, but they're always sharing how well, you know, it's after the fact that they realize how well prepared they are when they enter practice. A couple other things I just wanted to touch on that we continue to do is interprofessional education. Nursing continues to play a role in leadership in our interprofessional education. We have 2 different large experiences that our students do. One in their junior year where they learn about Fred Santiago, which is all about cultural diversity, accommodation, social determinants of health, looking at the needs of a patient across the care continuum and his family. The second is what the IPE forum that our seniors do, and that's the opioid crisis, which continues to remain timely, where they work with work and provide an interprofessional plan of care for our patient Ginny, who is an opiate addict and trying to recover, with, again, big emphasis on the social determinants of health and how they impact care for her. And although we're not able to do it right now, I'd also like to talk about the opportunities that our students have had in terms of global trips, led primarily by Dr. Molly Oldenburg, who has been taking the students on the trips. And other members of the faculty have also attended, but this goes for both graduate and undergraduate programs. And it's something that's so wonderful that we get to continue for our students. They come back getting some really different perspectives about what healthcare means, whether it be disaster preparedness with Dr. Joanne Sands, going to Haiti or the Dominican Republic, or just this past, oh my God, we were able to pull that one off. They went to Africa in December, thinking they couldn't have gone, but I guess they were able to go before anything happened. So really, the School of Nursing undergraduate continues to be really busy, preparing students not only for current practice, but the future. And my last two things I want to end on are, we are working towards moving to a concept-based curriculum that is being reviewed by New York State Office of Professionals right now. We recognize that we can't always teach everything in the traditional manner, and our faculty will be embracing a brand new change as we go to teaching conceptually across the lifespan in our nursing courses. So, you know, the grass does not grow under our feet at the University at Buffalo. We're always very busy, and it's great to tell you all about these things. I think that was it. That's all I wanted to say. So great to give you an update.
Wonderful. Thank you so much, Kathy. Now we will please hear from Rebecca.
I think I'm unmuted. Hi, everybody can hear me, right? So I'm here to talk about our PhD program, and I'm very excited to tell you that the program is still strong. I had 2 students graduate in December, and we still have 28 students within our program. We have 2 students that were affected. They're ready to start their dissertation research projects and had to pause a little bit because of the COVID, but so we're looking at how to change those in order to continue research in case this continues on, the staying at home. And the other thing I wanted to share is we have a great application class coming in. So we're in the process of interviewing right now. So the applicants this year are very strong, and we're very excited to see the new cohort coming in. So I'm here to answer any questions that you might have. Thank you.
Wonderful. Thank you, Rebecca. And now lastly, we're going to hear from you, Paine, about research.
I'm Yu Paine. I'm the Associate for Research, and I'm here to give you a brief update regarding our research and scholarship productivity. And I would like to begin with a little bit good news regarding our research expenditure for last year. So last year we received over $2.8 million in research funding, and it was one of the most successful year ever. So we really proud of our faculty who worked so hard to push our research proposal and training proposal. And about more than 90% of our tenure track faculty received external funding, which is also a record number. And so these funding projects are actually very interdisciplinary in nature. So faculty work with researchers from engineering, medicine, psychology, geology, and public health to address issues such as opioid crisis, smoking cessation, using telehealth training for our DNP students to provide care for people in underserved areas and address sleep disparities, and also provide behavioral intervention to improve insomnia, mental health, as well as substance abuse. So this is kind of a update in terms of our research productivity. Now we receive the funding, we have to do the work, right? So how can we actually continue our research activities in this crisis? So Center for Nursing Research, which I'm in charge of, has been working with faculty and students to make a transition into a remote methodology in terms of recruiting and delivering interventions, and also work with our PhD students and DNP students to find ways to transition their project to technology assisted related projects. And also a announcement that the Center for Nursing Research is currently working on a virtual poster section for students and faculty to disseminate their research and scholarship project through Zoom. And we want to do something a little bit more creative, interactive, so people will be able to interact with them, with each other through Zoom. And our IT support is going to be very critical. So we are working with the IT on this opportunity for presentation. Hopefully that this would take place sometimes in October, November, and we definitely will send out an announcement to our all alum. And this is my update.
Grace, can I just say one quick thing? As I was hearing us talk about our students, there's always been a question around the university. What's going to happen? Are students going to continue to come? Will we lose students and new applicants? And I just wanted to let you know, obviously, nursing is so in the forefront and people are so impressed and proud of it that our applicant pool has increased. And so we're getting a very strong group of both undergrad and graduate students who want to come back to the School of Nursing, as well as students who have an associate degree and want to get a baccalaureate for our RN to BS. So we've been really, really pleased to see that that continue, and that's putting a lot of work on our student services, but they're doing a fabulous job.
Wonderful. Thank you for sharing that update, Marsha. And thank you all for sharing your updates. That was such great information. Now I'd like to pass it over to any questions that we have. So as a reminder, please post your questions in the chat. I will start with one that I received earlier. This is from Adrienne Roy, who was unable to attend today's session, but is looking forward to watching the recording. So she is scheduled to be a preceptor in the psychiatric nurse practitioner program, which is now online. And so she's looking to see if there's any guidance or information about what's going to happen with the future of this program. And I believe Pam will be able to speak more to this.
So with the COVID situation, the psych mental health program has increased in numbers in terms of applicants. Unfortunately, it is one of those areas that we are trying very hard to place students in. And for precepting, that has mainly gone over to telehealth right now, and the telehealth is being done within people's homes. So it is a work in progress, but we have had some difficulty, but Dr. Nisbet and I are continuing to work on that in terms of trying to make sure that we do have adequate sites for our students, because not just the COVID, but the substance abuse situation has really made people want to come back. And I'm not sure if people are aware, but in addition to our psych mental health DNP program, we also have a psych mental health certificate program where people who are already board certified in another discipline can come back and for a smaller amount of credits get a certificate in psych mental health that gives them enough knowledge that they can be boarded in a second specialty. And this is becoming more and more of a approach in healthcare to have integration, particularly of psych mental health with either family or adult medicine. So, so again, we are working hard to find those sites because we do have a lot of overlap between the programs right now, with students coming back, family nurse practitioner students and adults going back to get their psych mental health degree on top so they can serve the population in both ways. I think one of the funny things was when Dean Lewis and I presented this to the North Campus, their response was when we said that they would come out as both a family or adult nurse practitioner along with psych mental health, they said, well, it's like getting internet and cable in one visit. So they truly understood, but I do think that's the wave of the future. So we are continuing to work hard at addressing that, but it is a very difficult situation.
Perfect. Thank you for answering that, Pam. Also, just a quick reminder, I know that some of you started a little bit after noon, but I did ask if everyone could please put their name, affiliation, and email address in the chat function. That will just help us keep track of who attended and make sure that we can communicate with you after this. So I don't see any other questions in the chat, but if anyone else would like to ask something, please feel free to unmute yourself. I know that we have some individuals who are on their phone today, so you may now speak up if you would like to ask a question.
Hi. This is Betty Noyes speaking from Portland, proud to be a member of the class of '65. So I'm chronologically gifted and proud of it. I just got off another conference call with the Oregon Nursing Workforce Commission. And that discussion was primarily focused around the school's need for PPE. And it was quite an interesting collaborative kind of discussion as to how all of the schools contributed their PPE to the acute care or whatever to providers when the COVID began, and now their supplies are empty. So it was a pooling of who in the community has access to vendors who might provide, and there were lists and all this kind of stuff. But I just wanted you to know that you're not alone out there in looking for PPE for students. Being chronologically gifted, I made the suggestion that it be reconsidered to use cloth. Remember gowns, guys? Maybe many of you are not that old, but you know, they were cloth gowns and they were cloth masks. And so the conversation kind of unfolded, but interestingly enough, it kind of revolved around back to cloth without me ever having to say anything. I was really glad to hear you talk about telehealth, and I'd like to hear a little bit more about the funding that Zoom is doing for research. It certainly is a very, very hot topic. I got very involved with a CCRC out here in which we were trying to get our residents to use telehealth because OHSU, the Oregon Health Science, I'm going like this because they're right over my shoulder back there, was their emergency rooms and everything was absolutely swamped. And the answer could have been, is, whatever was the use of telehealth. Well, now our telehealth capacity is overflowing. So it was a big success. Now, how much elders are using telehealth is another question. So when you look at telehealth out there, how are you addressing the more elderly population?
So maybe let's, we have the project director of the telehealth project here. Linda, would you like to talk about it? And I will, I have some comment after that. Linda?
I'm coming, sure. I'm in Hawaii, for everyone who is wondering. So the telehealth grant will be ending, but we've done a lot with implementing and training the students and getting ready. We have not done a lot specifically with geriatrics, but I know Dr. Montgomery is working with that in a nursing home setting, and we're looking to expand that. Like wound care, treat in place where you would, the nurse takes the iPad to the patient in the nursing home, for example, and then Skypes with or Zooms with the clinical practitioner, and they do an evaluation that way with the nurse in the facility guiding the call for the resident. Another thing, I just, there's a active senior living home, and I just heard that this week they had a Skype visit with a psychiatrist in Rochester for one of the patients that is a chronic patient there, lives independently but sees the psychiatrist every month or two, and that went very well. Instead of transporting the patient to Rochester, risk of exposure, risk of bringing disease back into the facility, it worked very well. So we're going to be expanding that.
Pam?
So I just wanted to let everybody know, so we were asked to be the authors, the University at Buffalo School of Nursing, on a telehealth book chapter in terms of embedding telehealth into our curriculum. That is at the publisher, it's been signed off on. So we really were front runners on this with the grants that Linda was just referring to. So we introduced telehealth to all of our students in their health assessment course in terms of putting their hands on the equipment. Now, of course, that equipment has been dated out. You know, it's just changing so rapidly, and the kits were just huge that our students were having to take with them to clinical. But we partnered with rural and underserved communities, mainly the Tuscarora Indian Reservation, where the students were doing telehealth there. A lot of the faculty that are practicing, I shouldn't say a lot, but some of us who are practicing are going to be using telehealth. Patty Nisbet, who's our leader of our psych mental health program, is doing her practice via telehealth. My clinic had been closed down at Roswell because of COVID, but it is resuming June 2nd, and it will be a telehealth clinic that I will do with the bone marrow transplant patients virtually that are over a year out, so that, you know, I'm not worried about their lab tests or anything. It's more of an educational opportunity. So as COVID has pushed telehealth forward, I think there'll be more opportunities for our students to use that. But Marsha and I have been in discussions that we really do need to sustain and grow our telehealth knowledge of our students. We've had to date 4 DNP projects that have focused on telehealth, and that one of the students actually helped us publish our book chapter. So we really are, I think, one of the programs on the cutting edge of helping our students know that technology, because when they go out, that's going to be great on their resumes to see that they have a telehealth skill set.
Right.
Yeah.
Well, thank you for that. That's really very encouraging. If anybody ever wants to talk to me about my 6 months experience in trying to promote telehealth with an elderly community, I'd be more than delighted to contribute free of charge.
That's
Thank
great.
you, Patty. Yeah, thank you. Really, I would like to have your input on how to actually use telehealth for the adult population. And you are really right on the research trend. That is definitely, there's definitely a barrier for telehealth delivery in terms of how comfortable individuals are with technology. Right. So there's a lot of research opportunity going on to understand barriers and facilitators. The technology to deliver the services is actually person-centered. So I think the more input from you, that will really help us, especially some of our faculty are actually interested in learning more about how we can use telehealth to the best we can.
I would be delighted to contribute, and maybe I'll come back and get my doctorate. I mean, you just never can tell.
Welcome. Thank you. I would love to help you.
It's hard enough getting my master's at Columbia. It's, you know, coming back to you guys would be really tough.
Wonderful. Thank you.
But Betty, our PhD program is an online program, so you don't have to come back to us at all. You can stay right where you are.
But that raises a whole nother level of discussion. You see, I believe in a minimum of 83 laughs and 10 hugs a day. So I can't hug you guys, you know.
There is that.
Yeah. Well, speaking of hugs, how are you all taking care of yourself? Silence.
I would lift up my puppy, but she's asleep at my feet. So I will share everybody that UB has seen my puppy, but you know, and Marsha, well, actually Sarah also has a new puppy too. So lots of shelters and different places are clearing out with their animals because people are home alone, but it's important. And plus we all see each other all the time on these Zoom conferences.
Oh, good. No wonder you're all so suave and debonair. Yeah.
I think we see each other more than we would normally see each other at work, for sure. But I think that's a really important question, and we keep talking about that. And you know, being the dean and being a nurse and being a mother, I want to make it all better and know that I can't just, you know, wave a magic wand. So I think we try to stay connected. Until last week, we'd had weekly open forums for all our faculty and staff, and I've had up to 65 people on a Zoom meeting. In fact, at 1 o'clock we're having our next Zoom meeting. So it's staying connected. We try to send out emails just to let people know that we value what they're doing. But then you're right, it's got to be your own self-care. What works best for you.
Yeah, right. Well, the analogy to the grieving process just keeps coming back and back in my own personal feelings as well as the literature. And that is, you know, we've going through this transition into acceptance, but it's painful. It's absolutely painful. And I don't think any of us should minimize that, because particularly you folks that are right there, if you're not feeling good yourself, you know, you're not going to be able to have a healing, comforting, compassionate, collaborative communication.
Right. Well, I was thinking my research has been with family caregivers of persons with dementia. And one of the things we always say to those caregivers is, remember what the flight attendant tells you, put your oxygen mask on first before you help someone else. And what do you need to make that oxygen flow? It is easier said than done, for sure.
Definitely.
I think we count our blessings too, because we have jobs, and you look at so many people that don't, that, you know, we all have bad days regardless of COVID or not, but you just reset it by saying, I have a job and I have the ability to try and make things better. And that's what pushes you forward to the next day. Just like when you lose a patient, the next day you go in, you want to make it better for the next one coming down the road. So maybe they don't have to go through the same thing.
At 7 o'clock every night here in Portland, many people are going out onto our balconies and banging pots and pans and ringing bells. And I tell you, it makes me cry every night, because it's such a sense of community support for healthcare workers and first responders. So well, you can't see it obviously, but I have Christmas lights up in the window, and that's supposed to be another symbol of supporting healthcare workers. So it's really exciting. I try to remain in close contact with the chief nurse execs throughout the Portland, and actually my practice is national, so I'm in touch with people across the country. And it's really rough for those who are in administrative positions who maybe they're teaching the message of self-care, but they're not practicing the message of self-care.
I'd be really interested in some of the others of you, and what's your life like right now, and what's happening, and what might help us to know a bit more about you.
I'm going to take a quick moment just to unmute everyone in case anyone is unable to unmute themselves. So it looks like you are all unmuted. All right, so if anyone would like to share what they're up to now.
Well, hi, Yvonne Shear. Can you hear me?
Mm-hmm.
Yep.
Okay, I'm having some technical problems. Nothing new. I haven't changed since I worked at UP. So anyways, I just like to say hi to everybody and say how proud I am at all the wonderful things that the School of Nursing is doing and continuing to do and be in the forefront. I was very pleased to see that one of the undergraduate nursing students was showcased in the Buffalo News, and the work that she was doing at, I think it was South Buffalo Mercy Hospital. I don't know at any time in my life that I have felt more proud of being a nurse than I am at this point in time. And if anything ever good comes out of this pandemic, I feel like the public has gained a much better perspective on nurses and what they do and how they are willing to put their own welfare on the line to take care of their patients and give them the kind of care that they need. So kudos to nursing, and it's unfortunate I'm at the point in my career where I can just sit back and applaud, but I am a nurse and was involved in nursing for many years, and very, very proud of what nurses are doing.
I'm taking good care of your office, Yvonne. So it's good.
Are you?
Yes, I am. So.
Are you in my office now? Oh, good. That's nice. That's good. You're looking great, Pam. I know you've got your hands full with everything. Oh.
Wonderful. Well, thank you. Was there anyone else who wanted to ask a question or share an update of what they've been up to?
This is Cheryl May. Can you hear me?
Yeah.
Yes, we can.
Cheryl?
Yes, And I'm having very windy weather here, so I might cut in and out a little bit. But I also want to congratulate all of you for all that you're doing and all that you do all the time. But now it is just amazing how nursing has stepped up and really taken the forefront. I have a lot of non-nursing friends and acquaintances who have said things to me like, I never really knew what you did. So I think that you're very right, that people are getting much better appreciation of nurses and nursing work. I'd like to just wish all of you a wonderful Nurses Week and, of course, to stay safe.
Well,
Thank
Cheryl,
you.
it's great to hear from you. It's interesting. Cheryl's on the East Coast and Betty's on the West Coast. And so we've got people all around. And I just want to let everybody know that Cheryl May this year is our Alumni of the Year. And so we need to applaud her, even though we were hoping to give her her award at our May celebration. We are going to we'll have to find a time next year when we can all get together and do that. But we're very proud of all that Cheryl's done in her career.
Thank you.
My name
I
is
did-
Barbara. Can you hear me?
Barbara?
Yeah, Barbara Braden.
Yes.
I'm actually I'm an alumnus with MSN was in '74 and BSN in '76. I mean MSN. Bleh, I'm turning it around. At any rate, I just realized I'm retired military, and I'm just realizing how much I miss the nursing camaraderie that when I'm listening to all of you, it's really it's very profound for me, because I've been here in my house for weeks and weeks alone, and just talking to listening to other nurses has been great. So I want to thank you all for talking with me.
Well, thanks for being on with us. This is fabulous. Where are you? What part of the country?
Oh, I'm in Tennessee,
Okay.
in a place called Clarksville, Tennessee, near Fort Campbell.
Hey.
As I said, I'm retired military, and I've done inter-service transfers into the Commissioned Corps of U.S. Public Health Service, into the and gone to Indian House Service in Arizona, and in the Coast Guard. I've been with the Coast Guard for 6.5 years. So, and the rest of it was in the Army.
That just
Thank you
makes me-
again.
That just makes me think about one of our alums, Rebecca McCormick Boyle, who was what was her? A rear admiral in the Navy, and retired a couple of years ago and moved back to Buffalo. Last year she became got an honorary doctorate as one of our alums, and we're very pleased to have that. But this year she has joined she's retired, but she's so energetic, she wanted to do something. So she joined Catholic Health, and she started the St. Joseph's COVID Hospital, the first hospital in New York that was only for COVID patients. And it's just exactly what she does. She loves to be the leader and coordinate, because she was the chief nurse of about 6,000 Navy nurses in the past. So we're very proud of her too. So thinking about our alums who have been in the military, it's a wonderful thing to see. Thank you.
All right, were there any other questions? Oh,
Yeah,
we have.
Yeah, my name's Dean Christian. I'd like to say hi to Dean Lewis.
Hi, Dean.
And also I saw Mary Glenn was on the list.
Yep, she was here.
Say hi her. I so wish my wife Patty could be here, because you know, she's on the front line at Albany Med in the pre-admission testing unit, and she's also at a nursing home. And they were doing very well until 2 days ago when they had their first COVID patient. And now they have 4. And it's been so frustrating because every day it's something different. The protocols change, and it's just this mass confusion. And Albany is kind of at the epicenter here. They were taking patients from New York City. And right now, for 7 weeks now, there's been no elective surgery. So the hospital census, and it's just a very complicated time. But what I wanted to say is we're going to miss our trip to graduation. But I did hear from Amanda Reback and learned the name of the award recipient, and she said a really nice video, thank you, and it was really neat. But we're hoping to connect with her and you, and I just want to, again, I think nurses are, they're God's people.
Thanks so much, Dean. Good to see you. Say hi to your wife for us.
Thank you.
And I just wanted to make one more shout out. We've been talking about some different people and awards, and I want to let you all know that Pam Paplham this year is the 2020 Advanced Oncology Certified Nurse Practitioner of the Year. So congratulations to Pam.
Wonderful. Does anyone else have any other questions or anything else they would like to share? Well, if you think of anything after the fact, please send us a message. We'll be happy to provide any answers that we can. And like Marsha said, if we don't know something, we'll try our best to figure it out. So real quickly before we close up, I just wanted to let everyone know that because this is Nurses Month, we have been sharing thank you messages to nurses every day on our social media channels. And we also have them all collected on our website. So after this, I'm going to send out an email with all this information. So you could feel free to check it out and share any messages with anyone that you know, whether if you're a nurse or if you know a nurse. We've had some really beautiful and touching things from the community. So I'm really happy of the responses that we've had. And like I said, I'll be sharing some other information as well, like the links to the student support phone that Marsha mentioned, as well as some of these wonderful alumni stories that have been brought up during the conversation. So before we sign off, Marsha, would you like to share anything else? I think.
Let's find my clicker here. Not really, just wanted to thank you for, and Pam, I'll just thank you all for being here and for what you do, and Pam has something to say.
I just want to give a shout out to Dean Lewis because her leadership has been tremendous through this whole experience that nobody has encountered before. And she really has been accessible, you know, well into the evening hours and early AM hours, and has given us leadership that is really over and above. So I just wanted to give her a shout out too.
Thank you.
Thank you, Pam. All right, well, Marsha, I'm sorry, did you have anything else you wanted to add before we sign off? All right, well, thank you all for joining us today. This was a wonderful conversation. I'm so happy that you were able to join us. Like Marsha said, hopefully we're able to do this more often. It's a great way to connect with people who we don't always get to see, even with our local events. So I appreciate you taking the time to meet with us. And if there's anything else that you'd like to know, just shoot us a message. But other than that, please have a wonderful day and enjoy your weekend if you can.
Bye-bye.
Bye.
Miss you, Yvonne.
Bye, Yvonne.
Bye, Yvonne.
Okay,
Great.
just the two of us. Perfect. I thought that went really well. I was, I just saved the chat and I was